as a recap of the previous slide, so regarding the questions, what were you told to expect, or what good effects are you supposed to expect coming from the effects coming from the doctor? Okay, so you ask the patients if the doctor really uh, give her or give him informations regarding the side effects of the drug. For example, do you experience any nausea and vomiting? Okay, show and tell questions. So what do you take the medication for? So you have to show the medications and how do you take it. So uh, you ask questions if the patients can know how to take that medicines. Okay, you have to verify to the patient, I mean. Okay, next, exploring symptoms. This one, knowing how to explore patient symptoms and how to evaluate their relationship to either the disease or its treatment is the key assessment. So you have to do the assessment skill or evaluation skill to explore really the symptoms of the patients regarding his or her conditions. The first step is to get the patients to reveal more information about symptoms. So this is an introductory statement. Tell me about it. It encourages the patients to provide more specific details of the symptoms. Example, you're suffering from a what do you call this one, arthritis. So what are what are the uh, what are the symptoms? Okay, so what are your feelings right now? How do you feel right now? Okay, so if the patient's response, I feel like body pain, there is what we call a muscle pain there, okay, or joint pain. So it tells more about uh, the conditions of the patients. After this, the key symptom questions should be used. 7 focus open-ended questions, okay, based on the medical interviewing technique. 6 specific that will help to define the symptoms related to a drug for therapy. So there is a key symptoms questions like onset, the timing. When did you notice this, or when did it start? So that is the onset. Okay. So the patients will reply, it started last 2 days ago. I suffered a severe pain uh, in my knee joint. Okay, because of the patient is suffering from rheumatic arthritis, for example. Duration, how long have you have this problem? So the patient will really reply, oh, this is almost 5 days from now. Okay, context under the circumstances, does these symptoms appear already? Okay, quality, what does it feel like? Okay, the quality of the symptoms. Okay, so this is severe pain. Okay, quantity, how much and how often do you notice this one? So almost 5 days, or almost uh, every 6 hours, uh, every day I suffer pain. Treatment, what makes it better? When have you done it? So this one is very important also for the treatment. If the patient suffering from arthritis, so usually the drug prescribed by the doctor is NSAID drug. Okay. So associated symptoms, what are the symptoms are you having? So there are a lot of aside from pain, so may muscle pain. Okay, there's what we call a lower back pain. Okay. Next, monitoring and education of the patient's return visit. So for example, this is very important. One simply way to look at all patients returning for follow-up in chronic diseases is use 3: control, complications, and compliance. Okay, usually this is done by the doctor or even in the pharmacist. Okay, so the control, complications, and compliance of the medicine. To evaluate and control the chronic diseases, look objective findings, blood pressure, range of motions, with subjective findings from the consultation report. So this is usually done by the physician. Complications can occur both the disease progression and side effects. As with the control parameters, combinations of subjective findings, so symptoms, that is subjective, objective findings, health record, patient profile, and then disclose presence of the potential complications. So usually this is done by the clinical pharmacist. So later on, if you arrive in the clinical pharmacy subject, this is what we call a case study. Okay, there is subjective and objective. So mostly, mga objective, this is already based on the past medications or past medical history of the patient. Next, to conduct more efficient patient interview. So avoid making recommendations. Yes, that is very good. It will be misinterpreted also. Okay, during the information gatherings. Such recommendations prevent patients from giving you all the need of the informations, because if you keep on giving recommendations, the patients will try to misunderstand you, because uh, she can misinterpret informations that are considered to be cause danger also to his illness. Okay. Oh, interfere with your ability to grasp the big picture patient needs. So similarly, do not jump to conclusions or rapid solutions without hearing all the facts. So you have to keep on asking questions and listen to the patients first before you jump to the conclusions. Okay? Do not shift from one subject to another until each subject has been followed. So you have to focus first on the first issue or the conditions of the patient. Guide the interview using the open and close-ended questions. Similarly, keep your goals clearly in mind, but do not let them dominate how would you go about the interview. So just focus more on the patient's conditions, okay, patient's information coming from the doctor, and patient's drug therapy.